So the next thing we're going to have a look at now is adjusting our weightings. So I've just spent a few minutes there changing the field sizes and conforming the field a little bit better. So it's not quite right in a few places, but it's better than it was. But obviously when you come to do this in the session, you're going to spend a lot more time getting it much more accurate than I have. So in terms of what weightings do, this is something that's a really nice tool for us to control the dose. Now I've chosen 3 fields for this plan, which is probably not something you would do clinically, but I just wanted to do this so it wasn't the same as what you were doing, so you have to think a little bit about what's going on. So I've only got 3 fields to think about, and I've popped on some extra isodoses now so that we can see the full kind of spectrum of dose distribution. So if we look across here, we can see we've got everything from 20 up until 107, and what we want to do is minimize the dose outside of the PTV and try and balance some dose inside the PT if we can, to get an even dose distribution. We're going to do that with a combination of wedges and weightings. So with 3 fields we're probably not going to be able to achieve the desired effect, but we should get it close. With 4 field you'll get better results than I'm getting. So ideally what we want to do is have no more than 80% dose out in this region here, this region here, and this region up here. So if we look at the moment, we can see, looking at these isodoses, let's just move that out of the way, you can see that we've got 85% around here, and if we look here we've got about 50% up there. So we've got an unbalanced plan across those fields. And if we use this tool here, we can click on here and we can see, for instance, that there's 89.2% there, and if we look here we can see there's only 52% there. So what I want to try and do is reduce the dose along here, because this is too much. But we can't just get rid of dose, we have to move it from one place to another. So what I'm going to propose to do is minimize the dose here, and to do that I'm going to increase the dose up here. Now if you've got 4 fields you need to have a bit more of a think about that, particularly with this post field, and have a think about how much dose you want to have going through this. So Eclipse has got quite a nice simple tool in order to change weighting. So you can either click F3 or you can go to that option there, and we can see here that as it stands we've got 33.3, so a third of the weighting going through each beam. And if we click there we can see that'll automatically update the dose every time we make a change. So just to kind of show the effect of what this does, so I can reduce the ant field, and as you can see as I do that it's increasing the dose to the lateral. So now we've got hardly any dose coming through here, but lots of dose coming through the laterals, and you can see here that our maximum is now nearly 128%. Clearly if we were to do the other way then it would look something like that, and we could also change something like that as well. So we can put lots through the left, or we can put lots through the right. And so you can see by moving these sliders, changing the weighting has a huge impact on the dose distribution. So we're going to click equalize and get them back to normal. If you've got several fields, so 4 fields or more, and you might want to adjust, so even with 3 fields, thinking about it, what we could do is we could lock the ant, for instance, and that allows us just to change the lateral. So we might want to do that to balance things out later on as well. Okay. If you've got more than 3 fields, you can lock more than 1 field at a time to do that. So let's click equalize again. So what I'm going to do, as I say, is put more dose through the ant and less through the lateral. So again, iterative process. So let's just start. I don't know the answer to this. What I'm going to do is just start gradually changing that, and as I do that we can see, let's just go back to where it was, we can see that that pink colour, that 80%, has now gone from the left side. And there's still some there on the right, so let's give that a tweak more, and a tweak more, and we can see we're now increasing the dose up here. So if we bob our little slider there, it's gone from 52% to nearly 62 now. So I'm just going to keep increasing that to something like that maybe. Okay, so we're just looking on one slice as I'm doing this. As ever, we need to remember that we're planning in 3D, so we need to scroll up and down as we do this to review the plan. We can also see that this is having an impact down here in terms of reducing some coverage down here, and it's also creating a hot area up here, a hotter region, so we're going to have to address that as well. So we've now got less than 80% in those regions. In terms of considering this anterior beam, we may want to have a think about how much dose we want to put through there. Because we've got the patient's penis there, and superiorly we are obviously coming through the bladder, and we're also potentially going to go through some small bowel superiorly. So I'm going to adjust that to try and balance that out as much as possible. So I'm not going to optimize it fully because I want you to have a think about that as well. The other thing we can do is, if we look at the laterals now, we can see on this side there's 76, and on this side there's only 72, so there's a bit more still going through this side here, and you can see that by the size of this salmon colour. So again, have a think about what we might adjust there to balance those out.